So we're starting interview season for aesthetic fellowship training.
My name's Nishant.
My name's Rami.
Hey, I'm Kylie.
Ruptured. Sometimes you don't know implants ruptured. You can't tell.
So that was already like that?
Yeah. All right, Chase, cross your fingers that this one's not ruptured. Take a behind-the-scenes look of my life as a plastic surgeon. Bright and early. Got an interesting day today, a little bit different than a normal day for me. Got my first week of interviews for my fellowship.
My name's Nishant, and I'm a plastic surgery resident at the University of Michigan.
My name's Rami. I'm a plastic surgery resident at the University of Michigan also.
I'm Kylie. I'm from the University of Wisconsin in plastic surgery residency there.
Kind of a way of giving back, you know? Giving back to the future and kind of carry a little bit of us into their future practice. So we're starting interview season for aesthetic fellowship training, which we have in our practice. And we train our plastic surgeons for a whole year just with aesthetic surgery within the course of the entire practice of 7 surgeons and the infrastructure and facilities of our practice.
Expecting a great day, good mix of cases, and just learning from some of the experts in the field.
I'm just really excited to see how this incredible practice functions. It looks like a really busy day, and it's just amazing to see such a high volume of high quality plastic surgery performed.
We do these cases in residency, but not to this volume. So it's really exciting to see and just to meet everybody. There's a lot of new faces and everyone seems super friendly. So just excited to spend some time with everybody today.
We got the first group this week. Very excited to meet them and work with them. And they get to work with and observe all the surgeons of the practice and get to interact with the staff and see what we do here at ACPS. This is the heart of the practice. Surgery center running 4 hours. This is like I would say average day for us. It's been a good day. I'm not going to go. I'm not going Dr. Morales' normal pace. I'm trying to slow it down a little bit. That way I can kind of interact with these guys just a little bit more. First surgery today was a liposuction with fat transfer, also known as a BBL. And she was actually one of my patients before. And she gained a little bit of weight, and she still want to kind of maintain her curves with a smaller waist, flatter tummy, streamlined figure, a little more fullness for the butt. So she's gonna do great. She looks great already, but we're gonna make it, finish the final touches on her.
Still have a great look up here.
A little bit fatter, like I figured. Technique of fat transfer, we kind of have our own way to do it. Yeah, death grip. Like a death grip, you're gonna feel it, but it takes a lot less effort to do what you need to do. This is just my fingers.
Yeah, that's a good one.
So I just gotta make sure it's all released. But she had a little flat spot here, and hold on, that's it. It's called the Morales elbow.
Sounds like a wrestling move.
I got it from my massage therapist. She just kind of puts her elbow and just leans her whole body weight into it. And so the point of this is the fat that the entry point where you put the fat in. If you don't do this, what happens? It bulges here, and then when the recovery, they'll have it bulge. And so if you just kind of push it away and get it into the soft tissue the other way, it stays the way it is. So you can see it's flatter now.
Yeah.
I've been doing this for pretty much an entire career with this technique. And anyway, it's a great case, very straightforward. She's kind of smaller, which is kind of my patient population, a little bit smaller, not too big. So she's having a great outcome. I'm excited for her.
Awesome. Thanks for letting me join.
Yeah, man.
A bunch of the liposuction techniques and fat grafting techniques that Dr. Morales was showcasing were things that I haven't seen before, and so that was really grateful to just be able to see that.
All right, so next case what we're doing is she's had implants in, I think placed in Colombia, if I remember correctly. And so we're gonna downsize a little bit, her implant size. She feels like she's a little top heavy. And then we're replacing with the newer generation gel implants. And then she also had a breast lift around the areola, which in my experience never works out very well. So we're gonna revise her breast lift more into a full breast lift because we're gonna do reduction of the implant size. So we're gonna kind of reshape her breast into a smaller percure form. So my goal for her is to have a shape that can kind of stand alone without a bra. That's kind of my goal for her. We'll do some body contouring to kind of streamline her down. It's all kind of midsection, You know, liposuction abdomen and back and flank and bra line area.
Interesting.
Kind of bring it down. It'll make her breasts look bigger and better. Kind of changes her silhouette. So. Ruptured. So we need another basin. I need some clindamycin. Sometimes you don't know implants ruptured. You can't tell at all by just visual. Surgery 2 definitely threw me for a curveball. Wasn't quite expecting that.
That's fine.
So that was already like that?
Yeah. Really kind of manually debrided, so basically just get it to come off on this stuff here. It's looking pretty good already. The process of removing the implants that are ruptured, cleaning out that space, cleaning out the soft tissue that's been contaminated with the free silicone. A little more labor intensive, but it's very important to get that all clean and cleaned out, and then the new implants replaced. All right, Chase, cross your fingers that this one's not ruptured.
I'm gonna cross them because that looked awful.
Chase, did you cross your fingers?
I was crossing them.
These look like they're like 1970s, maybe 80 implants as far as the way they're behaving as a silicone. Or they're South American. They're South American. That's why the United States has such strict regulations on implants. There's only 2 implant vendors in the United States that produce silicone implants. And the world is like 18. So that's why the FDA approved implants always be better for patients for safety purposes. Rupture rate. A lot more science and research goes into development of these implants. Rejuvenated her shape with a tighter, perkier form, a little bit smaller shape and volume than she had before, which is what she wanted, to go along with the body contouring that I did with her for the liposuction to further enhance her figure and give her the right curves in the right areas.
Oh, yes, girl. Now that's working.
Those ruptured implants really stressed me out a little bit, but to see Bahar come in with blood all over her face really kind of lightened the mood for me a little bit.
Like everyone that comes to ACPS, you're just kind of taken aback at how productive they are and how efficient this place runs, and it's fun seeing their initial reaction to that level of productivity.
It's remarkable to see a practice run this efficiently.
I noticed speed. They're all very fast and very efficient. I also like the camaraderie. Everyone seems to get along really well. They all seem like they're all good old friends, which is nice to see.
It shows you, kind of gives you a glimpse of how you can run a really busy practice and move rooms really quickly and do a high volume of excellent surgery.
So you got to see some surgery, you got to see the interview process, the potential new ACPS aesthetic plastic surgeons that we train. Hope you got an insight of a day in the life of my life as a plastic surgeon. If you like it, don't forget to like and subscribe. On the next episode of the FitDoc Chronicles. Next time you see me, we're gonna be in Hawaii. The Sean Ray Hawaiian Classic.